Hello and welcome to this teaching video. My name is Dr. Mazhar, and in this video we will discuss about the sepsis, the septic shock, what is SOFA score, what is qSOFA score, how to early diagnose this patient with sepsis, and how to manage it in emergency.
So, sepsis is actually a life threatening dysregulated immune response to an infection leading to widespread inflammation, organ dysfunction, and potentially shock. So, the sepsis is actually a bizarre and abnormal immune response to an infection.
Sepsis can be triggered by various types of infection, among which the bacterial are the foremost, are the more notorious for it, causing sepsis. About 95% of cases are of bacterial infection, and among bacteria, there are four major bacteria that can cause sepsis. Number first is Staph aureus, second is E. coli, Pseudomonas aeruginosa, and Streptococcus pyogenes. Among fungal infections, the Candida species and Aspergillus species are the main offender. And among viruses and parasites, malarial parasites can cause sepsis. Among viruses are the influenza and COVID-19 virus. The infection sources are the common sites that results in sepsis or that slips into sepsis are the respiratory system, pneumonia, urinary tract infections, gastrointestinal infections like peritonitis and appendicitis, and also some of the soft tissue and skin infections can also lead to sepsis.
So, who are at more risk of developing sepsis are there is increased tendency to slip into sepsis are the elderly, infants, diabetics, chronic kidney disease patients, immunocompromised patients, and recent surgery or invasive procedure patients. Okay, what are the signs of sepsis? What would you look in a patient with an infection and belonging to the high risk group that whether he or she is developing sepsis or not? So there are some early signs in which there may be fever or sometimes hypothermia, tachycardia that is increased heart rate, tachypnea that is increased respiratory rate, and confusion. What are the signs of organ dysfunction? If there is persistent hypotension, if there is decreased urine output, if there is hypoxia, and if there is altered mental status. So the each sign of organ dysfunction will represent an organ that is
What is
involved.
qSOFA score? The qSOFA score, as the name suggests, Q, quick sequential organ failure assessment. It's a quick assessment of an organ failure. So a qSOFA is actually a bedside simple screening tool used outside the ICU to identify patients with increased risk of poor outcome from sepsis. It contains three clinical criteria: respiratory system with respiratory rate greater than or equal to 22 breaths per minute, systolic BP less than or equal to 100 millimeter of mercury, and altered mentation. Altered mentation means confusion or GCS level of 14 or less than 14. So these three clinical criteria are used and each have 1 point. So if a qSOFA score of 2 or more is there, it suggests a higher risk of sepsis and further evaluation is warranted.
Okay, now let's talk about the SOFA score. What is SOFA score? Unlike Q SOFA score, the SOFA score is actually a detailed monitoring tool to predict mortality and morbidity of the patient, monitoring organ dysfunction, and to check the treatment response. So, what is SOFA score? The SOFA score, sequential organ failure assessment score, is a clinical tool used in intensive care units, while qSOFA score was outside the ICUs. It is used to track and quantify the extent of organ dysfunction or failure in patient with sepsis. So, how is SOFA score calculated? As we have already studied about the qSOFA score, in which only three systems were studied, but in here in SOFA score is calculated using the following six organ system: the respiratory system, cardiovascular system, renal system, hepatic system, neurological system, and coagulation system. So here in SOFA score, the labs investigations are also involved. In the respiratory system, it is measured by the ratio of arterial oxygen tension to the fraction of inspired oxygen. In cardiovascular, assessment based on the need for vasopressor medication to manage hypotension. If there is persistent hypotension despite fluid therapy and we need vasopressor medications like epinephrine. Renal system evaluated by serum creatinine level or the amount of urine produced, urine output. Hepatic system determined by the patient's bilirubin level, and the neurological system, it is assessed using the GCS Glasgow Coma Scale, and coagulation system is evaluated by the platelets counts. The total SOFA score is the sum of these six components, with a maximum of 24 points. A higher SOFA score indicates more severe organ dysfunction and portends a worse prognosis. So, if the SOFA score is higher, it means there is more severe organ dysfunction. Here is a table for calculation of SOFA score, in which there are points from 0 to 4 and 6 systems were checked. Initially, the platelets count has been given the different values, the bilirubin levels, the cardiovascular system, and there is the in if you can appreciate in the level 2, 3, and 4, there is a need of vasopressor, dopamine, and epinephrine, and there is also the GCS, the Glasgow Coma Scale, and the creatinine level. Different creatinine levels have different points, so you may calculate it from there. When you label a patient that is of sepsis, that this is a sepsis patient, and what happens in it, that the dangerously low blood pressure that does not improve despite adequate fluid resuscitation and requires medications called vasopressor to maintain blood flow to organs. So that it will be labeled as septic shock. It is the most severe stage of sepsis, characterized by persistent hypotension, increased blood lactate levels, and signs of organ failure. Okay, how to diagnose a case of sepsis? So there is clinical criteria and some labs. In clinical criteria, we use qSOFA score outside the ICU and SOFA score inside the ICU to check for the severity of the sepsis. On labs investigation, we look for CBC, TLC count may be high, look for platelets that may be decreased, blood lactate levels, procalcitonin and CRP levels, and blood culture to know about the offending organism and to specifically treat that infection. So it is actually the combination of clinical criteria and the lab's value. There are some new researches and biomarkers that has been added in the diagnosis of sepsis. That those markers are Pre-Sepsin, that is very much important, monocyte distribution with interleukin 10 and heparin binding protein. They help guide early diagnosis, antibiotic use, fluid management, and vasopressor therapy. How to manage a patient with sepsis? In management, the early recognition is the key. For good prognosis of the patient of sepsis inside or outside of the ICU, we need to early recognize the case. So initially, immediate broad spectrum antibiotics are given, aggressive fluid resuscitation is done, vasopressor for persistent hypotension if there is hypotension. If a patient need oxygenation, look for that, mechanical ventilation if needed, and treating the underlying source.